World Health Organization began when our Constitution came into force on April 7, 1948, a date now we celebrate every year as World Health Day. We are now more than 7,000 people working in 150 country offices, in 6 regional offices, and at our headquarters in Geneva, Switzerland. Our primary role is to direct and coordinate international health within the United Nations system. Our main areas of work are health systems, health through life course, non-communicable and communicable diseases, preparedness, surveillance, and response, and corporate services. We support countries as they coordinate the efforts of government and partners, including bi- and multilateral funds and foundations, civil society organizations, and the private sector. Working together, we attain health objectives by supporting national health policies and strategies. WHO is the directing and coordinating authority for health within the United Nations system. It is responsible for providing leadership on global health matters, shaping the health research agenda, setting norms and standards, articulating evidence-based policy options, providing technical support to countries, and monitoring and assessing health trends and improving global health security. The world now has more young people than ever before. Of the 7.2 billion people worldwide, over 3 billion are younger than 25 years, making up 42% of the world population. Around 1.2 billion of these young people are adolescents aged between 10 and 19 years. Adolescence is a critical time of life. It is a time where people become independent individuals, forge new relationships, develop social skills, and learn behaviors that will last the rest of their lives. It can also be one of the most challenging periods. In this turbocharged neurological, physical, and emotional transition from childhood to adulthood, young people face a range of health risks. They are often exposed to harmful products such as tobacco, alcohol, and drugs. They face greater risks of violence, including homicide, and road traffic injuries than in childhood, and can experience devastating mental health issues such as depression, anxiety, self-harm, substance abuse, and addiction to video games, as well as eating disorders and suicide. Dr. Valentina Baltag at the Department of Maternal, Newborn, Child, and Adolescent Health at WHO stated, "Adolescent health is a smart investment. Not only will it improve adolescent health and survival in the short term, but it will bring benefits for their future health as adults and for the next generation to come." An estimated 6.3 million children under 15 years of age died in 2017, or 1 every 5 seconds, mostly of preventable causes, according to new mortality estimates released by WHO, UNICEF, the United Nations Population Division, and the World Bank Group. World Health Organization is currently seeking applications from eligible applicants for the post of NPO, Repro, Maternal, Newborn, Child, and Adolescent Health, in Thimphu, Bhutan. The duration of this post is 2 years. Objectives of the program are to support the Ministry of Health in the development and implementation of evidence-based policies and strategies in order to provide equitable access to quality reproductive, maternal, neonatal, child, and adolescent health services and environmental health. The proposed position of the national professional would allow WHO to provide the necessary support for implementation of maternal, neonatal, child, and adolescent health and environmental health-related activities. NPO will perform the following functions: provide technical support to the Department of Public Health of the Ministry of Health in review, development, and implementation of the RMNCAH, in particular the neonatal component, and general support to the maternal, child, and adolescent health program. Provide technical inputs and support to design and perform an in-depth situation analysis on health system response and capacity to improve maternal and child care with focus on newborn care services. Contribute to the development and support implementation of the National Strategy and Action Plan for Environmental Health. Provide technical and pragmatic support in implementation of the WCO BHU priority activities in light of the flagship priorities and within the framework of RMNCAH, including the development of national framework, tools, and guidelines for quality improvement. Support Batoon Newborn Action Plan, BNAP, and its implementation focusing on the quality of services. Assist Ministry of Health to review and finalize the health service policies and guidelines on maternal and newborn care, and provide technical support in the development and introduction of new approaches, methods, and practices in program management and evaluation. To be eligible for this position, applicants must have a university degree in medicine, health, or relevant social sciences, postgraduate degree in public health, epidemiology, or related field will be an asset, at least 2 years experience in the relevant areas, be familiar with government policies, priorities, structure, and procedures on implementation of activities related to reproductive, maternal, neonatal, child and adolescent health and environment, health. Previous experience of work with WHO or other UN agencies is an advantage. They must be proficient in using computer applications, Microsoft Office, to produce reports and prepare correspondence. Have excellent report writing skills in English and a nationality of Bhutan. World Health Organization has a competency model, which is a framework for defining the skill and knowledge requirements of a job. This list is a collection of competencies that jointly define successful job performance. It is as follows: communicating in a credible and effective way, knowing and managing yourself, producing results, moving forward in a changing environment, fostering integration and teamwork, respecting and promoting individual and cultural differences, setting an example, creating an empowering and motivating environment, ensuring the effective use of resources, building and promoting partnerships across the organization and beyond, driving WHO to a successful future, promoting innovation and organizational learning, and finally, promoting WHO's position in health leadership.